my name is Anna Marie Sinatra, the CEO of Sinatra Solutions, a coaching, consulting, and training firm that partners with you to catapult you to the next level in whatever it is that you're up to. Whether you're an individual that wants to sharpen your skills professionally, maybe it's leadership development, maybe you're the owner of a business and you have employees that you have to manage, maybe you're a manager, we can do that together. And if you're a business or an organization and you want to create those peaceful working atmospheres where your employees can work together as a team, we can do that with diversity training and conflict resolution and soft skill training. We can do it. We can partner together to get you where you want to be.
Hi, I'm Ava Sammarco, the practical nurse. I enjoy bringing you current and up-to-date health information for today's changing world. And I do this by hosting Health Focus.
And I host Health Matters.
And we collaborate to bring you focus on health matters.
So before we get started, we want to thank some of our sponsors. We want to thank Mattress & More, where Maddie Mattress is educating us in a variety of ways on how to get a restful sleep. You could never believe there's so much information when you're looking for a new mattress. If you have problems getting a good night's sleep, maybe you have some injuries like I did, knowing all the different details about those mattresses is so important, and he's doing such a fine job in educating the community.
Go right to sleep.
Yeah.
Also, we'd like to thank Western New York Imaging Associates, Dr. Frank Mascaro, providing state-of-the-art imaging equipment to assist you in your time of need. With many locations throughout Western New York, Kenton MRI, Lockport MRI, and Western New York MRI, downtown Buffalo, and his equipment in several other facilities throughout Western New York. Yeah. You'd be surprised.
Yeah, you would be. He's like all over.
Wow.
Yep.
Great.
And we want to thank Joe DeMarco from Wings Flights of Hope, where his volunteer pilots are flying sick children and people all over the United States in their time of need, whether it's a transplant service or, somebody gets that call in the middle of the night. God knows if you had to call the airlines, you pay a fortune. They have volunteer pilots that stay on call waiting for you to call them. So without any further ado, you want to tell them about making sure they got those pens and papers.
Pens and papers.
So you take lots of notes and let's get started.
I have been so excited for this show. I haven't seen Frank in so long.
And I wonder why you haven't seen him in so long.
I know, I missed it. I'm sorry. Shame on me.
Yes, shame on you. I've been there so many times and he always asks, "Where's Ava? Where's Ava?" One thing or another, life keeps happening, right? That's what's always happening.
I know. Life gets in the way.
Yes,
that's
it does.
true.
They say, you know how to make God laugh?
No, how do you make God laugh?
Tell him your plans.
Oh, I like that one.
That's
I'm
a good
going to
one,
use that one.
And not only have you missed Frank, but you missed Tony Lyons.
I have.
From Western New York Pain Management Center.
Oh, I know it.
They're opening up. We did the show that, I did the show there.
She did the show.
But we did that wonderful show where you learned a lot about the whole medical campus that is being opening there. Yeah, medical campus, medical park. I just think it's amazing.
Ooh. Well, I understand there's a collaboration going on.
That's right. That's right. And they're here to tell us some more about it. Dr. Frank Mascaro and Tony Lyons, thank you so much. Once again, Dr. Mascaro, for your continued support for this program, which is always showing the community how much you're so committed. And this is just one of the areas. So thank you.
Thank you, Anne-Marie. Ava, it's great to see both of you today. And
you too.
Hopefully we have a great show to, give information to the people in the Western New York area.
Yeah, and so tell us a little bit about, and we've already been there. You invited us out. We did a show with Tony, and the place is absolutely incredible. It's so exciting because of the deficit that's occurring in our area with so many people leaving. So tell us a little bit about that and what you're doing there.
Well, with pain management, it's a center that we've designed with Tony really leading the charge for the Pain Management Center, along with our director, Dr. Wag Marie. It's a very necessary medical benefit for people that are in chronic pain to seek out medical attention for pain management and get people back to work and functioning in life, and that's very important. At Western New York MRI we can help diagnose and help image certain pathology, but what do you do for it after that?
Exactly.
And,
Right.
Our friends over at Pinnacle can help out if it's a surgical issue, but at Western New York Pain Management Center, we can help out with the management of the pain that can be debilitating to our patients.
And Tony, you were mentioning when we were there that you're doing some on-site procedures as well.
Absolutely. We're really excited about it. We have pain management specialists, and the minimally invasive procedures that they do at the center are part of what pain management doctors do, but it's an important part. My brother called me yesterday. He was listening to NPR, and they were going over something concerning treatment of pain. And there are so few pain management physicians that just specialize in pain management. There's a lot of physicians that deal with pain that are general practice, and they, I'm sure they do a good job in their own modality, but these are doctors that are specializing in pain management. And these procedures are an excellent alternative for many patients for long-term chronic pain and acute pain that can avoid, dangerous prescription medications, as well as a good alternative for the physicians and the patients from possibly
that's incredible.
unnecessary or other surgeries.
That's
So, yeah.
incredible, incredible. And what's so wonderful about it too is that a lot of times people don't drive, or they have to rely
Exactly.
on public transportation.
Right.
And you're so centrally located right in the heart of downtown Buffalo.
Yeah, we have a bus stop right there. We're on the Metro line, less than a quarter of a block away from the front entrance to where Western New York Pain Management Center is. So it's ideal. We're right off the ramps to the 33, and also the 190 is just up Elm Street. So central location for people to get to.
And huge, huge, huge. You have a beautiful parking lot.
Yeah, that's a plus. Yes.
That's a big one. That's a very
190
big-
spots. So
How
many?
190.
Oh my,
Oh my
goodness.
goodness.
Yeah.
Wow. Wow. You might start renting them out. No, I'm just kidding. Because it's always so hard when you have to go downtown.
Yeah.
That's why sometimes people hate going downtown. But as you've heard me say so many times with your imaging, even my doctors send me, I'm out in the South Towns, and send me downtown because they want me to get really good imaging that is going to zero in on the issue.
Yeah.
Well, that's what's important. I mean, giving convenience to the patients, how to get to our location, and free parking, free and plentiful parking.
How could you go wrong? Really.
Perfect situation.
Exactly. And with all the deficit that's going on, not only do you have this available now in Pinnacle, but you've also brought in some new imaging equipment, because with Sheehan closing down, that left a big hole for women in terms of breast imaging.
You're absolutely right. We're really ramping up at Western New York MRI to provide full service women's imaging. So we have obviously mammographic examinations, ultrasound, DEXA scan. We also have MRIs for breast MRIs, and we can also do biopsies with the MRI if
That's
it
great.
needs to be done.
Wow.
Yeah, absolutely. It's all state-of-the-art equipment. It's really fantastic, and we kind of look at the patients comprehensively, so to give them full service. And really, it's pretty much a one-stop shop for us and
Yeah.
for the patients.
It's so important to get your mammograms, and a lot of times something isn't detected, unless you go for a mammogram.
Correct.
Because even you should be doing your self-breast exams, but it may not be detectable.
Absolutely.
Right?
Self-breast exams are extremely important, as well as your scheduled mammographic examination.
Yes.
Wow. So again, you are filling a lot of holes that this community needs, and we are so grateful for it. As a matter of fact, we I don't know if we all
We
are
don't
going
know
over.
what you, but
I'm going to come over and take a look at that breast imaging equipment and interview you and Dr. Serghany, and Ava's got to go run out and take care of another program that we're doing. We're going to come over and take a look at that so that everybody gets to know what's going on at Western New York MRI, Western New York MRI Group, and Western New York Pain Management Center, and I'm calling it the whole park, the whole complex, to serve you in the community. So thank you
Great.
once again.
Thank you
Thank
again.
you, Emery, Ava. Thank
Let's
you.
go over
Thank you
and
very
find
much.
Dr. Serghany. Thanks for coming in. I found them. I found both Dr. Frank Mascaro and Dr. Joe Serghany. Thank you both so much once again. Your continued support to this community, especially now more than ever before with our hospitals closing down, your support and what you're doing. And what are we going to call this area? Like the Western New York Imaging Compound or Park or what? Because this is amazing here.
Thank you, Emery. Welcome back to Western New York MRI. And you know, today's a real nice day to kind of talk about the new advances that we've made here at Western New York MRI by incorporating women's imaging. We've got
which I have my arm in. What he's going to tell you what goes in there.
actually, this is our brand new digital mammography machine here from Hologic. It's state-of-the-art technology here, and we also across the hall have DEXA as well as ultrasound, so we can take care of women's imaging needs right here downtown Buffalo at Western New York MRI.
Wow, and plenty of parking too. That's why I don't want to forget to tell you folks, and sometimes I forget, and because that's such an issue when you come to downtown Buffalo. You can come on your lunch hour, you can come before work, after work. They have such a variety of hours servicing the community. You don't have to worry about getting across town to another place that closes at a certain hour, be caught up in rush hour traffic, and come right after work, have somewhere to park and get all your needs taken care of. Dr. Serghany, thank you so much for taking, you guys are so busy. We appreciate you taking the time out.
Thank you, Anne-Marie, for coming here again today. And as you said, you know, women can come at their lunch hour. This is digital, as Dr. Mascaro said. It's quick and it's fast. And we made the commitment for that process a few months ago before we put our 3 Tesla MRI, but we needed to wait till the construction phase is out, till the place is clean and safe and it's comfortable for the patients. But as soon as GENESEE Memorial Hospital closed its doors, that was the only mammography around. And not only we replaced it with mammography at our site, we made sure that it is digital mammography. It is state of the art. This is what the patients around us deserve, and that's what we're committed for.
And tell me why, and tell us so that we're learning more, why is digital so important?
Digital mammography studies have shown is higher quality than plain film mammography. You could change a little bit the viewing criteria on the monitor. It's better to view the calcifications, and the computed assisted diagnosis is immediately incorporated in the image itself. That gives you a helping hand in deciding if there is a mass or if there are calcifications that are sometimes a little bit not too conspicuous. It helps show them to us.
And I think, Dr. Mascaro, you were mentioning too something about you can view them from different locations too if the patient wants to share with their doctor or something right away.
Correct. These images will be on our packs, so I can always ask a second opinion of one of my colleagues that's across town.
So you're saying then we don't have to run to a different facility and different doctors to get second opinion?
Absolutely not.
Oh my goodness.
We can always ask one of our colleagues.
Wow.
And we're interconnected through our fiber optic system throughout Western New York, from the South Towns all the way to Lockport and Newfane area. So it's very important that this information is at the fingertips of even the patient's referring physician. If they wanted to take a look and we can review them together, they can be on their computer and we can be on our computer and kind of telling them, this is what I'm concerned about, and I can even circle it and make a little note telling the patient's physician what we're concerned about and what are the next steps on going on to it, and as well as breast surgeons can be able to look at our images on their computers at their fingertips.
Wow, how much time does that save? I can't even imagine.
That is amazing. And another important issue is you don't have to deal with the issue of lost films, because if the film is lost or misplaced, it was, it was a major issue. Now it's no longer. It's all digital, saved on a hard drive, backed up on another hard drive. We can print images if we need to, but we still have the digital format of all the images. So that is great. And as Dr. Mascaro mentioned, you could have a second opinion immediately. Some of our colleagues, we talking to each other and consulting on the same patient if we need to.
Well, as a woman, I pray to God that I never need these services. I know I've used your services in the past and have always been treated with such tenderness and kindness and such a great atmosphere. And all I could think about, God, like I said, God forbid, for breast cancer, having the best imaging equipment available right in the downtown area, and then knowing that in the unfortunate cases where something is shown and you don't have to run around, that is so much comfort that you can get a second opinion without even blinking.
Correct. And Anne-Marie, those services are also screening, not only for women with breast cancer, it's to screen to make sure you don't have, and God forbid if there is, you catch it at an early stage. And this complements our MRI that does breast MRI, and we're equipped to do MRI-guided breast biopsies. We could do ultrasound-guided breast biopsies, so we're bringing a lot of tools and a lot of modalities available for women's imaging at Western New York MRI.
Wow. And thank you for bringing that up, because I'm just thinking, when I'm hearing you share so much about what you're doing, I'm thinking of how helpful it is in your time of need. But what Dr. Serghany said is really important. You absolutely have to get that imaging done once a year, as well as your female exam and anything else, even bone scans now that you're over a certain age. We're not saying what age. Bone scans are important. All those things are important because you speak to the importance of finding it right away. You save a life.
Well, like Dr. Serghany said, it's very important about early detection and early intervention. To catch something early, be it osteoporosis with a bone scan, to get supplements to build up your bones, or is it by catching an early lesion in the breast? And it could be benign or it could be malignant, but you have to work it up. And we have the tools here, downtown Buffalo, to work up these cases and to provide the information not only to the patient, but to the referring physicians, which is very important on keeping the process going. After we find something, then the next phase is going to a breast surgeon or to their physician, and to get that ball rolling and to get the process going for people to know where to go to the next step.
And I want to remind our viewers once again, too, that you can ask your primary where you want to go. If that even makes sense, you tell them, I want to say where you want to go, but you can ask/tell them where you want to go. Because I always tell that story before I even knew you, when I had a health issue, I don't even know how many years ago that was, and I'm out in the South Towns, and my doctor sent me here. I was like, why do I got to go all the way into the city? It was before I practically live in the city. Now I'm here every day. And this is where he sent me. And so what's important about that is for you to be proactive with your health. When your doctor tells you something, ask questions and say, well, gee, I saw this, and you can request to come here. So any last thing that you want to say before?
Well, in closing, Anne-Marie, I think what's very important here is to get your studies done and to have the lines of communication. Dr. Serghany's brainchild has been our PAC system, and we've built this fiber optic network across the city and reaching as far as Lockport and Newfane and in the South Towns, where referring physicians can get the answers to the questions that they ask in the imaging of their patients. So they have them right at their fingertips. So communication is very important, and that's why we take pride in what we've done and what Dr. Serghany envisioned many years ago.
Well, I thank you for investing in the city of Buffalo.
Thank you. I want to illustrate something he just mentioned is for the city of Buffalo, this service is available. So for the women, we just want to make sure that they know that it's digital mammography, the highest standards ever in their hometown. They don't need to travel. They don't need to go through any trouble to get to a place that those services are provided. It's right there in their backyard. And thank you, Anne-Marie, for letting everybody know that.
Oh, you're welcome. It's my pleasure. Thank you both so much. You got a lot of great information about women's imaging and women's, hopefully, no issues. But they do have an issue, they know now what they can do and what's available to them. But let's talk a little bit more about that preventative too and how you tie it all in here.
Well, what's necessary is that women have their self-breast exams monthly, and they come for their screening exams once a year after the age of 40. It's important, it's preventative care, and that's how we keep our people healthy in our community. So it's very important. Preventative care goes a long, long way. So that's what we're promoting, making it easy for the inner community here in downtown Buffalo to have women's imaging right here at their fingertips, right here at the base of GENESEE in Michigan, and right in the medical corridor. So it's very important for people to get the advantage of being right downtown in their community to get their imaging done and to have a safe bill of health.
And you know, it's so nice you're doing so many projects here and expanding with so many different services. And it once again speaks volumes to the community, your commitment to the community, because it wasn't too long ago you saw Dr. Mascaro get his award from Miss Bessie Patterson for supporting the Martin Luther King celebration in the community too. So your commitment really speaks volumes. Every time you turn around, you're doing something great here.
I'm so honored to be the chairperson for this very important program celebrating the life and legacy of Dr. Martin Luther King Jr. And we could not do this program if it wasn't for sponsors like the Western New York Image Group. We're so happy, Doctor, that you chose to help us present this prestigious occasion. And we're just honored, and we hope that you will continue your sponsorship. Thank you so much.
Well, thank you, Betsy, in allowing us to be part of the Martin Luther King celebration. It's very important for us to be part of our community here in Western New York, and we'd like to be a part of it for years to come.
Thank you so much.
You're welcome.
Thank you. God bless.
Thank you. Well, we'd like to thank the Martin Luther King program for allowing us to be part of their celebration. It's a very important day to remember and to be part of in our community. And we'd like to thank everybody involved with the Martin Luther King Celebration Day.
It is a great honor to receive this recognition, and we love this community, and we would continue supporting this event year after year as we've supported this community and as this community has supported us and kept our doors open within their midst. It's been a great pleasure. It's been a great journey since we came here in 2002 to Western New York MRI, and the growth in our neighborhood around us has been phenomenal. We couldn't have been happier. We couldn't have been more honored to be included in this event. Thank you.
Well, it's very important to be active in the community that you live and work. So here at Western New York Imaging Group, we've taken pride in being part of the community and reaching out to people and making sure that we provide services for them at their fingertips right here in downtown Buffalo.
That's amazing. And when I was in the conference room too, I saw a couple of other awards too. You don't ruffle or flap your feathers too much, so I'm doing it for you.
Well, we've always been taking the charge to reach out when we're asked to help. We're long time the radiologists at Sheehan, and unfortunately they've closed. And a lot of services that they provided, now hopefully we can pick up the slack for the people of downtown Buffalo and all of Western New York, not just downtown Buffalo. We've been helped out at ECMC when they had a little problem with finding help for the radiology, and we kind of picked up the flag and helped them across the line until they have phenomenal radiologists there at ECMC. We've always helped out at the VA hospital, supporting our veterans that have done so much for us.
Wow.
And it's very important. We take community service and community pride to it's very important to us. So we try to do our part to be part of the community.
Boy, if everybody just thought that way, what a better world this would be. Because you have the commitment to the downtown area, and many folks know, because I get the emails, and I know you're watching and sending your comments, because you have other facilities in other areas too, such as the Kenton Open MRI, which is really important if you're a little claustrophobic and you need that openness when you need the MRI. And a Lockport MRI, and there's another one.
Well, we
I'm being,
we have Western New York Breast Health on Sheridan Drive, and we're
okay.
working with Dr. Linfield, a renowned breast surgeon here in Western New York. You mentioned Kenton Open MRI, which helps out a lot of people that are claustrophobic, and also for our younger patients, mom and dad can kind of hold their hand and make them feel comfortable while they're getting their exam done. But also at Kenton, we provide CT, ultrasound, X-rays. At Lockport MRI, we have a phenomenal MRI magnet there, and we do great imaging for the eastern part of Niagara County. We're at, again, Western New York Breast Health. And we have multiple satellite offices that help out and help the community. We try to outreach into the community, making it more easy for them to get to places. Not everybody can just get around easily, so.
I was just thinking about that. When you were talking about the different facilities, I was thinking about how your doors are automatic, that it's wheelchair accessible, and another huge great thing about it is that there's parking available at all the locations, because I know I've been at them all.
Yeah, I mean, right here at Western New York, MRI and PET-CT, the whole complex here, there's 190 parking spots.
Wow.
So it's very important, and it's free parking. There's not paid parking here. Kenton Open MRI has volume parking there also, as does the Western New York Breast Health and Lockport MRI. All our sites we try to make it as easy for patients, because like you said, some patients have crutches, wheelchairs, and it's very important for us to make it easy for the patients to come into our offices, get their imaging done as quickly as possible, and then go on their way.
And now if they need a mammogram, they can do the mammogram, the bone scan.
Well, it's the DEXA scan.
The DEXA scan.
And ultrasound.
And ultrasound.
Right here at Western New York MRI.
Everything all at once. It doesn't get any better than that.
As well as, if they need an MRI, including breast MRI that we do, and like Dr. Serghany touched on, breast MRI guided biopsies. So we're trying to provide as much of the imaging that we can do for patients and to get the final diagnosis.
So thank you for watching. We really appreciate your emails and letting us know that you like all the programs that we're bringing you. We want to know if you want to be interviewed on this program too, so keep those emails coming. And we have a couple more sponsors to thank. We want to thank Mr. Frank's Barbershop and Beauty Salon. Yeah, you heard me, Barbershop and Beauty Salon.
Wow.
This used to be her dad. She's been there forever. And then she became a beautician, and now her father has since passed, and she stays there on that corner, providing all kinds of services and educating people on hair care, and she does medical pedicures. So as you start to get when you start to get a little older and you can't get down there to take care of what needs to be taken care of, there's ways you can do it.
Wow, that's neat. Wow. Also, the Healing Spa with Marge Reed offers holistic, non-surgical facelifts, facial chakra balancing, color and light therapy, and many other therapies, helping to bring the body into balance wherever it is needed.
So keep watching, keep emailing us, and stay focused, because
your health matters.
See you next time.